If you don't have perfect vision or you are tired of wearing glasses or contact lenses to help you see, you may have considered laser eye surgery. In this video, we are going to show you from consultation to recovery the procedure of corrective laser eye surgery. We're here at Shine & Bright Eye Center, where a multitude of Korean celebrities have visited and can attest to its reliability and service. Today's patient is our friend Dave, who is a popular online personality in Korea with over 1.3 million followers on Facebook. He wanted to get his eyes fixed, so we referred him to Tony, who confidently recommended Shine & Bright. When you arrive, a consultant will help you fill out some forms with some basic information, like your name, nationality, address, and simple medical history. You'll then go through a series of checks to determine the health of your eye and how much correction is needed. The first is with the surgeon, to check your basic eye health before the more comprehensive exams. Leaving the surgeon's office, there are a range of machines that can be used. For Dave, they use these three. The first is an auto-rev keratometer. This measures the refractive error of the patient's eye. The second machine measures the intraocular eye pressure of the patient's eye. There are three ways to do this, but in this case, a short puff of air is used to flatten the cornea. The amount of air required determines the internal pressure. This tonopaciometer machine measures the corneal thickness and again the pressure inside the eye. These tests help your doctor understand your eyes and develop the correct treatment plan for you. You will then take a basic eye test, something everyone has probably taken before. Once your prescription has been finalized, you will then wear these glasses to show how your eyes will be after the surgery. The next stage of examinations check for serious eye defects and complications. The first machine takes a picture of your retina for examination. The doctor will check for any problems. For reference, this is a healthy retina, and this is not. The next machine takes a 360-degree scan of your cornea's thickness. You can see your cornea detailed between the pink and green lines. An optical coherence tomography machine also measures your corneal thickness and the presence of astigmatism. After some mild anesthetic drops to the eye and another pressure test, your tears will be measured using these purple strips. They are placed under the lower lids of your eyes while they are closed for 2 minutes. The larger the wet area, the better. From this test, we see Dave is quite dehydrated. The fourth machine is the final check of your eye health before you move on to your consultation. A consultant will describe the different procedures offered at Shine & Bright. In this video, the smile procedure will be shown. The smile procedure involves corrections made by a laser underneath the surface of the cornea. Then, a tiny incision is made for the corrective material to be removed. Because there is no corneal flap created like in other procedures, there is a much lower chance of dry eyes post-surgery. Vision recovery time for smile is only 2 to 3 days. As Dave's eyes were healthy and because of the benefits of smile over other procedures, he booked his surgery for the following week right away. On the day of the surgery, don't wear makeup. You'll have your eye area disinfected in preparation for surgery and you will be required to wear this sterilized gown and cap. You will be given anesthetic eye drops at the same time. The surgery time is very quick and takes less than 15 to 20 minutes. If you don't like watching detailed surgical footage or close-ups of the human eye aren't your thing, skip ahead to 5:35 to hear Dave's thoughts and feelings about the procedure. If you think smile might be for you, contact Tony for a consultation. His information is in the description box below. Now for the surgery. You will lay down on the bed of the machine. Once you are comfortable, you will be moved up towards where the surgeon and his assistants are sitting. Your eyes will have clamps gently placed inside. Don't worry, before this time the anesthetic drops will have taken effect. Throughout the surgery, your eyes are kept well hydrated and are constantly looked after very well by the surgeon. Now the eye is prepped, the suction device will slowly lower over the eye and make a tight seal to prevent your eye from moving. The laser will then work its magic over roughly 30 seconds before the suction is released. The whiteness of the eye here is because there is a small layer of tissue beneath the surface that now needs to be removed. Using specialized tools, the surgeon will gently slide this curved hook-type device through a small incision and lightly tug at the freshly laser-cut tissue slice. Once it is free from the eye surface, it is removed. The eye is then hydrated again and the surface smoothed and ready for recovery. The clamps are then removed and that is eye number 1 complete. The process is then repeated for the second eye. Hydration and cleaning. Suction. laser, and tissue removal. You can see that this small amount of tissue is enough to have made your vision not perfect. The second eye is hydrated and smooth, clamps are removed, and the surgery is over. You will be checked by the surgeon one last time in his office and then you are free to go. If you want to rest, you can use Shine & Bright's recovery room, but this isn't necessary for the SMILE procedure. You will be given eye drops for your recovery and will come back the following day for a checkup. Now, let's hear from Dave.
So I just had my procedure. I was freaking terrified. Like I was. You saw me, right? Like I calmed down. Did you see me while I was doing that? I was just like my fingers were literally like this the whole time. It was really quick. It was like 15 minutes at most. How long was it?
It was a little bit under 15 minutes. It was really fast.
That was ridiculous. I've never seen a surgery go so quickly. You just get in there, you're right back out. I did the SMILE procedure, which is a little bit more of a complicated procedure. Apparently, it's a little more advanced of a procedure.
Yeah, it's a more advanced and complicated procedure, but basically once the procedure is done, you can leave. You don't even need rest time.
I'm still exhausted because it was a surgery. I did feel them messing with my eyes, which is an extraordinary feeling. And at one point, when you're doing the surgery, suction on 10 seconds. Like, you see everything and then suddenly everything turns white and you can't see anything. But it was really cool, really fast. Apparently I'll have perfect vision by tomorrow, he said.
Yeah, by tomorrow you come back to the hospital, they're gonna check, you'll be fine. You'll function like you have perfect vision, like you're Superman.
Really?
Well, not exactly, you won't fly.
I want to be Batman, I want to be Batman, I want to be Spider-Man. I was here with my wonderful friend Tony Medina, and I will have my actual post feelings on my actual video, because unfortunately everything looks foggy right now, and that's how it's supposed to be. So yeah. Thanks a lot, Tony Medina, my beautiful friend.
No worries, buddy.
Recommend this to anybody who wants to fix their eyes. Using your Sanzingin Tang, you're friggin' awesome. You're the best. Thank you for fixing my eyes and making me like a small newborn toddler again. Children have good eyesight, right?
Children have great eyesight.
Children have great eyesight.
Yeah.
I'm a little baby again.
This is not the only laser eye procedure available at Shine & Bright. In a later video, you will also see the LASIK procedure. If you were impressed with the results and are interested in getting this or other dental and cosmetic procedures done in Korea, contact our good friend Tony Medina at Seoul Guide Medical via their Facebook page or by emailing seoulguidemedical@gmail.com. And if you want to see more content like this, please like this video and share it with someone who might find it interesting.